This is the dropout rates from follow-up to treatments worksheet on the C4P success tool. As you can see here, we can have two possible outcomes from this, either follow-up visit in 1 year or referral for cancer diagnosis. Here you have the dropout rates from the follow-ups to the treatment for those two things. The first thing you can do is you can have an ablation treatment that is complete and you're referred for a follow-up screening in 1 year. Certainly there will be some dropouts from that, and you can adjust your sliders here to tell the tool what you think the dropout rate will be or the loss to follow-up rate will be after 1 year. That's for ablation treatment. As you can see, I've set it at 20% here. For excision treatment, there's two possible outcomes. The first one is that you have a completed biopsy and histopathology, and that shows that there's no need to send someone forward for cancer diagnosis and treatment referral. Still, you would have them coming back for a follow-up screening in 1 year, and here you could have a dropout rate set as well according to how you adjust your sliders. Now here I'm going to set it for 10%. Also, if you have an excision treatment and the biopsy comes back abnormal, that means that there is suspected cancer possible, then you will be sending a person through for cancer diagnosis and treatment referral. There you could have a dropout rate of anywhere between 5% to 15 to 10, whatever you think is going to be the correct one. Now you can set that as you want here by adjusting the sliders. I'm just going to set it to 5% here. And then you'll see from that what the loss to follow-up will be in each of the years. And then you'll see how many procedures you're going to need to assume you will have in the coming years. So here you'll have, if you have a follow-up visit in 1 year set for 2024, that means that you will have 66,595 additional follow-up visits in the year 2025, and so on.